You've probably heard of the term diastasis recti, diastasis recti, or even just DR. Maybe it came from your healthcare professional, a midwife, or a OBGYN. Maybe it was a friend. Maybe you saw it on social media. Whatever it was, when you found out what it was, you went ahead and typed it out on Google, and the results that they gave you probably isn't going to be what I'm going to tell you today. Hi, my name is Dr. Sigri Reyes, and today we're going to dive into the world of diastasis recti and get to know a little bit more about exactly what it is. If you haven't done so already, make sure that you hit the subscribe button so that you have all the latest updates. First, let's start off with a little bit of anatomy, because we all need to know exactly what's happening with our bodies and just kind of have that background of what's going on. Our abdominals, especially like our six-pack muscles that you typically see on someone, are made up of two halves. So we have the two halves here, and in the middle we have a tissue called linea alba. This tissue is pretty thick and it helps to connect everything. However, when we are pregnant and we are growing through each trimester, that linea alba gets stretched out. Now, this is something that we obviously can't avoid if we are expecting, and especially even more so during that first pregnancy when the body is going through all these changes for the first time. So as our body is expanding, as we're getting further along in our pregnancies, this tissue stretches out, and it's normal for it to happen during all the pregnancies. However, after we've had our babies, this is when things should come back, that tension should return. Now, let's use a balloon as an example. All right, so this is our third trimester belly. Everything's nice and full, things still have some tension in it. But what happens when we have that baby? We don't always get that tension that we originally had when we first started out in our pregnancy. But what can we do? Can we ever regain that tension that we initially had pre-pregnancy? Unlike this sad balloon, fortunately, we can regain that tension with proper therapy, with proper time, and making sure that we are giving it exactly what it needs. That means making sure that we have some good tension when we do our workouts. That means making sure that we have good posture when we're taking care of our little ones, and making sure that we restore our breath and our connection with those deep core muscles. Now here's the thing. Diastasis can happen to anyone. You don't have to have necessarily been ever pregnant. Men can have it, lifters can have it. I've even seen babies with it. So at the end of the day, it's not that you were all stretched out, but it's actually a pressure management issue. As is with a lot of pelvic floor issues, it all comes down to how we are able to manage that pressure, or if we even have the ability to do so.
Here's an example of what I'm talking about. As I blow up this balloon and I put no tension in my core, you can see that the pressure is going downwards. My belly starts to pooch up and down as I start to blow into the balloon. Now, when I correctly engage my deep core muscles and I blow into the balloon, you can see that my lower abdominals stay flat while I continue to blow into the balloon.
Now, there are some things that the body does give us hints that we're not able to manage that pressure. One of the telltale signs of a diastasis is that doming, or that bulge that you might see someone get in the middle of their diastasis or in the middle of their core when they're doing things like a sit-up. They might be doing something like a pull-up, and they're creating just too much pressure in their abdomen, and so that you see that tenting happen, that doming happen in the middle of their core. This is our body's way of telling us we're not ready for that just yet. This is why you might also get that general statement or advice to stay away from sit-ups and crunches, that it might make your diastasis worse, because that's generally when you see that doming. However, not all doming is bad. There's soft doming, so meaning it might just be a matter of the tissue deforming in that area, and that's not a bad thing. Now, when the doming is firm, when the patient can actually feel that domain from the inside, then that's the type of domain we want to stay away from. That's telling us that's too much pressure, we're not ready for that exercise, let's modify. So the question isn't, how do I close this gap? It should be more of, how do I regain that strength to be able to manage my pressure? So the question shouldn't be, how do I close this gap, but rather, how do I regenerate that strength and tension to be able to manage the pressure? So here's the crazy part. A wider diastasis doesn't necessarily mean it's a bad thing. A wide diastasis is just simply telling you how stretched out it is, rather than how strong it is. We're more concerned about the tissue strength in the middle of that diastasis, or that linea alba, and how strong it actually is. How much tension can it create to combat pressure? Someone with a 3-finger gap in the middle might be able to generate pretty good tension and have more of a functional core, versus someone who has a shallower or more narrow gap but has a very soft tissue in the middle, and they might be experiencing more of those dysfunctional issues or even pelvic floor issues. Follow along for more as we unpack all things diastasis. If you're looking for more resources, make sure that you click the link below in our description to have access to this.